hygiene and body care for older people. Topic: how to take good care of yourself after 60 to feel comfortable, maintain healthy skin, hair, teeth, and nails, and prevent common problems. Introduction. Hello, dear friends. As we age, our body becomes more sensitive and our skin becomes more vulnerable. That's why proper and regular hygiene becomes not just a habit, but an important part of maintaining health and wellness. In this video, we will tell you how to properly care for your body, skin, nails, hair, and oral cavity in old age. It's simple, accessible, and uncluttered. Just what really matters. Part 1. Body and facial skin. Care. As we age, our skin loses moisture and becomes thinner and drier. This happens due to a decrease in the production of collagen and natural fats. In older people, the skin is prone to irritation, micro cracks, itching, and even infections. But with proper care, these problems can be avoided. Simple care tips. Wash not too often and not in hot water. Showering 2 to 3 times a week with warm water, up to 37 degrees Celsius, is sufficient. Frequent washing with hot water dries the skin. Use mild detergents. It is better to choose gels and soaps labeled for sensitive skin or baby. Avoid antibacterial and strongly scented soaps. They dry the skin. Be sure to moisturize your skin. After every shower, apply moisturizing cream or lotion, especially on your arms, legs, elbows, and back. Creams with glycerin, panthenol, or aloe are best. Pay attention to folds of skin. Under the breasts, armpits, groin. In these areas, irritation easily occurs. After showering, be sure to thoroughly wipe them dry with a soft towel and can be sprinkled with baby powder. Clothing should be comfortable and breathable. Avoid synthetics. It is better to wear cotton or linen fabrics that allow the skin to breathe. Example of a daily ritual: morning, washing with warm water, applying cream to the face and hands. Evening, warm shower with a soft gel, followed by a cream or lotion all over the body. Additionally, once a week, a light scrub for face and body to remove keratinized cells. You can make homemade from oatmeal and honey. Useful to know, if you have reduced mobility, you can use a sponge with a long handle. It will help you reach your back effortlessly. If there is a tendency to bed sores, it is necessary to change the position of the body every 2 hours, and the skin should be treated with protective cream. Conclusion of Part 1. Regular skincare isn't just about cosmetics. It's about preventing dryness, cracks, and infections. When your skin is soft, moisturized, and itch-free, your mood is better and your quality of life is higher. Spend 10 minutes a day and you'll feel the difference in a week. Part 2. Caring for hands, feet, and nails in old age. As we age, the skin on our hands and feet becomes thinner and drier, our nails brittle, and our feet more prone to cracks and calluses. All this is not only a cosmetic problem, but also a safety issue. A small wound on the foot can lead to inflammation, and a poorly trimmed nail can lead to ingrowth and pain when walking. Proper care of the hands, feet, and nails of an elderly person is primarily about hygiene, mobility, and prevention of infections. How do I care for my hand and foot nails? Trim your nails regularly on hands every 1 to 2 weeks, on feet every 2 to 3 weeks. Cut in a straight line, especially on feet, to avoid ingrowth. Use safe tools. File, scissors with rounded ends, and antiseptic for treatment. It is better to have a separate set for feet and hands. Don't forget about cuticles. Do not tear off and do not cut them hard. This can cause inflammation. It is better to soften them after a bath and gently push them off with a stick. Moisturize your nails and the skin around them. Dry nails break easily. Cuticle cream or oil will make them stronger. Oils with vitamin E or castor oil are especially helpful. How do I care for my feet? Once a week, give your feet a warm foot bath, 10 to 15 minutes. Add sea salt or decoctions of chamomile, calendula to the water. They soften the skin and relieve tension. The temperature should be up to 38 degrees Celsius. After the bath, remove keratinized skin. Use a soft grater or pumice stone, not metal. Do not overdo it. The skin should be smooth, but not damaged. Be sure to dry the skin between your fingers. This will prevent the development of fungus and inflammation. Use a separate towel for your feet only. Apply cream from dryness and cracks. Simple creams with urea up to 10%, petroleum jelly, baby cream, or ointments with aloe will do. How to choose shoes and socks. Shoes should be comfortable, soft, with a stable sole. No heels, narrow toes, or hard backs. Socks should be made of cotton or bamboo without tight elastic bands. Change them every day. In hot weather, twice a day. Hand care. The skin on the hands after age 60 dries out especially quickly, especially after washing. Use a protective cream immediately after every hand washing to protect against cracking. Wear gloves when doing housework and gardening, especially when in contact with water and cleaning products. Home ritual for the evening, foot bath, 10 minutes, pumice, and lightly treat the heels. Wipe dry, apply cream, cut nails only during daylight hours or with good lighting. Apply oil to the nails of the hands, cream to the palms of the hands. When you need professional help, the nails have changed color, become very thick, or are crumbling, there are cracks that won't heal, pain when walking, or an ingrown toenail. Have diabetes. In this case, even a small wound needs a doctor's attention. Conclusion: taking care of your hands and feet is not a small thing. It is the basis of comfort, freedom of movement, and even safety in old age. Regular, simple procedures can help avoid problems and make you feel well-groomed and confident. Part 3. Hair and Scalp. Care in older adults. After the age of 60, most people's hair structure changes. It becomes thinner, drier, more brittle, and the scalp becomes more sensitive. Men often experience thinning or baldness, while women experience dryness, increased breakage, and dull color. Also with age, graying increases, and this is completely normal. The main thing is to know how to care for your hair so that it looks neat and does not cause discomfort. Why is regular hair care important in old age? Well-groomed hair is not just about aesthetics. It is also an indicator of scalp health. A clean scalp prevents itching, irritation, and dandruff. Scalp massage and proper washing improves blood circulation and nourishment of hair follicles. How to care for your hair properly: wash your hair as it gets dirty. On average, 1 to 2 times a week is enough. You don't need to wash your hair daily. It dries your scalp and makes your hair brittle. Use a mild shampoo. Shampoos labeled for sensitive scalp, without sulfates and silicones, are best. You can choose shampoos with chamomile, lavender, provitamin B5. Be sure to use a conditioner or rinse. This will help detangle the hair, make it softer and less brittle. Gently blow dry your hair. Don't rub it with a towel, just gently blot it. It is best to use a microfiber towel. Do not brush wet hair. Wait until it dries and then use a wide-toothed comb. Do not use a hot blow dryer. Dry hair naturally or on a low, warm setting. Hot air dries the scalp. Scalp care. Massage your scalp once a week. Using your fingers or a massage brush, gently massage your scalp for 5 minutes to improve circulation and nourish the hair. In case of itching and dryness, use special oils. Burdock oil, castor oil, or coconut oil. Apply a little 30 minutes before washing your head, then rinse thoroughly with shampoo. If there is dandruff or flaking, do not use aggressive shampoos. It is better to switch to pharmacy products with zinc, tar shampoos, or mild care formulations. In case of severe symptoms, consult a doctor. How to cut hair. For women, short haircuts, bob, require less maintenance and are easier to comb. For men, keep a clean, neat haircut once every 1 to 1.5 months. If it is difficult to go to the barbershop, ask your loved ones or call a master at home. Tips. Comb. Choose soft brushes or combs with sparse teeth. Headscarves and hats. Wear in cold and hot weather to protect your scalp from temperature fluctuations and dryness. Don't color your hair frequently. As you age, your scalp is more sensitive. It's better to color once every 1.5 to 2 months and use gentle dyes without ammonia. Conclusions on the third part. Proper hair and scalp care is not complicated, but it is very important. It's not about fashion, it's about comfort, cleanliness, and self-esteem. Even a simple short haircut and a clean head of hair can make you feel invigorated, well-groomed, and confident. Well-groomed hair is another step towards a quality and active life after 60. Part 4. Oral care for older people. Healthy teeth, gums, and fresh breath. As we age, the health of our teeth and gums deteriorates. Enamel thins. Gums become sensitive. Inflammation, bad breath, and tooth mobility can occur. Many seniors have crowns, implants, or dentures. All of these require a special approach to care. Proper oral hygiene after age 60 is not just a matter of aesthetics. It is the health of the entire body, from the heart to digestion. Why it matters. Gum disease can cause chronic inflammation that affects heart function. Poor chewing of food due to dental problems leads to impaired digestion. Bacteria from the mouth can enter the bloodstream, causing complications in people with diabetes or hypertension. How to properly care for your teeth and gums. Brush your teeth 2 times a day, morning and evening. Even if you have dentures or a few teeth, it's important to clean your entire mouth. Use a soft brush. The bristles should be soft or medium stiff to avoid damaging the gums. Toothpaste with fluoride and without aggressive whitening ingredients. Toothpastes labeled for sensitive teeth or 65 plus are good. Don't forget to brush your tongue. Bacteria accumulate there, causing unpleasant odor. Use a scraper or brush with the back of the tongue. Gum care. Gargles. Daily. You can use drugstore rinses with chamomile, sage, chlorhexidine, or make homemade. Baking soda plus salt. Herbal decoctions. For inflammation of the gums, make gargles 3 times a day with decoction of oak bark or calendula. Gum massage. After brushing, gently massage the gums with your finger or a soft brush. This improves blood circulation. Special care if you have dentures and crowns. Rinse removable dentures every day. Use special tablets, available at the pharmacy, or a mild baking soda solution. It is best to remove your dentures at night. This reduces the risk of irritation and allows the gums to rest. Don't forget to clean the gums under your dentures. Use a soft brush or a tissue. If there are implants, be especially careful to clean around them. Use special brushes or floss. Breath freshening. Consume more greens, dill, parsley. They cleanse the breath. After meals, you can rinse your mouth with water with a drop of lemon juice or peppermint essential oil. Drink enough water. Dry mouth also causes odor. Tips and prevention. Visit your dentist once a year, even in the absence of pain. Don't trigger gum inflammation. Bleeding is a signal that it's time to take action. If it's hard to brush, use cotton swabs, wipes, or an irrigator. Conclusion: oral health isn't just about your smile. It's about the health of your entire body. Regular hygiene, taking good care of your gums, dentures, and teeth, can help you avoid a host of problems, from inflammation to digestive issues. It doesn't require expensive products, just attention and care. Cleanliness, freshness, and self-confidence. All this is what daily oral care gives us. Part 5. Intimate hygiene and daily body care for reduced mobility. As many people age, activity decreases and simple hygiene routines can be difficult. Self-care becomes especially important. It is not only cleanliness, but also skin health, protection from infection, comfort, and confidence. Intimate hygiene is especially important. Gentle and regular, age-appropriate hygiene. Why intimate hygiene is important after 60. The natural protection of the skin and mucous membranes decreases. Women often experience dryness and sensitivity of the mucous membranes. Men experience inflammation in the perineal area and problems with urination. There is a tendency to diaper rash, fungal infections, and micro cracks. Basic rules of intimate hygiene: cleansing 1 to 2 times a day. Use warm water, not hot, and a mild product with neutral pH, preferably drugstore gels for intimate hygiene. Movements are from front to back, especially in women, so as not to transfer bacteria from the rectum. After toileting, wash with water or use wet wipes without alcohol, especially if you have hemorrhoids or sensitive skin. After showering, blot dry. Never rub the skin. In the folds, under the breasts, between the buttocks, in the groin, you can apply a light talcum powder or diaper rash cream. Body care with limited mobility. Use long-handled washcloths or special wipes for hygiene of bedridden patients. For cleansing without water, there are foam gels and wipes that don't require rinsing. Water procedures, not necessarily every day. If it is difficult to shower, you can rub a damp towel with a non-rinsing gel and wipe the body with clean water. Pay attention to the skin folds and perineum. Irritation is most likely to occur there, especially when using diapers or pads. Clothing and bedding. Underwear, cotton only, no tight elastic bands. Change every day. If a diaper is used, change every 4 to 6 hours to allow the skin to breathe. Bedding. Change every 5 to 7 days or more often if necessary. Tips for women. During postmenopause, mucous membranes become dry. Use drugstore moisturizing intimate gels based on hyaluronic acid or with chamomile extract. Do not use spritzing. It disrupts the natural microflora. If itching, burning, consult a doctor. Self-treatment can aggravate the situation. Tips for men. Wash the genital area with warm water every day. Pay attention to the glands and folds. Plaque can accumulate there. If you have trouble urinating or a foul odor, it's time to see your doctor. Conclusions for the final part. Hygiene is not just a habit, it is taking care of yourself. Regular and delicate body care helps you avoid a host of problems, from infections to discomfort. Even if mobility is reduced, there are many simple solutions. Wet wipes, non-flushing gels, soft washcloths, help from loved ones or caregivers. The key is to not be shy about taking care of yourself. It's not a luxury, It's a daily norm that gives you confidence, cleanliness, and peace of mind.